So to outline our talk for today, we're going to start by giving you an introduction to who I am and a warning about the talk, talking about the new world of hearing care that we find ourselves in, the opportunity that I see for practices to improve these skills and what it can mean for your practice. And then I'm going to introduce you guys to a new tool that I've developed that you'll have free access to. So make sure to stick around until the very end because I am going to give you access to a new tool, and then Q&A. So let's go ahead and jump into it. If you guys aren't super familiar with me and my background, I am a former private practice owner. I launched a startup practice in Dallas in 2014. And the context behind this topic in particular, when I started hiring audiologists in the beginning of my practice, I just trusted them to run new patient consults. They were professionals with experience, so I just let them do their thing, but we didn't have a structured consultative sales system. And guess what happened? The results were inconsistent and unpredictable. Month to month, our treatment acceptance rates would fluctuate by 30%. So we were just like on a revenue roller coaster, and it was stressful and it was bad on morale. And I should have known better is ultimately the thing, because I was aware of business systems. Like I knew how to successfully convert patients into treatment programs, but for some reason, consultation process wasn't something that I had focused on systematizing my practice, even though it was responsible for like 90% of our revenue at the time. So starting in about 2016, I began the process of documenting. I documented my processes. I had conversations with some of the most successful audiologists that I knew in my network to learn what they were doing. I started going outside the field of audiology, studying things like motivational interviewing, learning about behavior change, learning about case presentation techniques from other fields like dentistry and surgery, where they've been doing these things for a lot longer and have really good established systems. I also spent a lot of money, tens of thousands of dollars, working with coaches over the years, business coaches. And over time, we developed a consistent consultative sales process. And I started coaching my team and training my team on using this process. And over the course of about 6 months, as we built this thing out and launched it in my practice, we went from my team, my staff audiologist went from about 50% treatment acceptance or conversion rate up to about 70%. And we continued to refine it over time, and we would almost always be above 70% treatment acceptance, sometimes even over 80% with private pay patients. And as I built that system and I built other systems in my practice, I was gradually able to step away from patient care. And my practice over time largely ran on autopilot. And in 2021, I sold my practice and I started teaching a lot of these business systems to other audiologists and practice owners. So today I'm going to share some of the kind of foundational insights, mindsets, thought processes around the sales process. So that's my background. Here's the warning. I am probably going to say some things during this presentation that represent a different perspective than you currently have, and you might disagree with me, and you might feel like I'm saying you're doing things wrong. My goal when I'm doing this type of training does involve making people uncomfortable, but I'm not trying to repel you or drive you away. I just see that so many practices have so much untapped opportunity, and the only way that we can grow is by intentionally making ourselves uncomfortable. So if you're super opposed to that, then this might not be the best training for you. But if you are excited about the opportunity to help more patients and learn skills to do that, then you're in the right place. All right. So here's where we are, right? You're undoubtedly like acutely aware of all the forces that are making hearing care more competitive, more challenging to operate in, more confusing for patients. Part of my goal with you here today is that you can leave with more of a clear vision on how you can differentiate yourself from low cost, low value competitors, and that you can communicate the value of the life-changing work that you do so that you don't feel like you have to compete on price. So the number that I had always historically heard was about a 50% treatment acceptance rate. I'm having conversations with people who run large organizations in audiology and hearing that it's actually more on the 40% side for a lot of practices when we're talking about exclusively private pay. And I know a lot of you guys that are here are international. And so some of the numbers that I talk about might look a little bit different. Some of the mindsets might be a little bit different because of the culture and the economies and that sort of thing. But talking about practices in the United States, 40 to 50% is pretty fair. So if you think about an average established practice that's seeing 20 candidates per month, and they have a $5,000 average treatment revenue per patient and 45% treatment acceptance, which is about what a lot of practices are doing, that practice is generating $45,000 in monthly treatment revenue. Now, here's the opportunity, because in my experience, any practice who's actually providing a high level of patient care and who learns how to communicate the value of what they do in a systematized way, and they implement these things consistently and effectively, are capable of helping 70% of patients that come into the practice. And that's true even for providers who are, quote, not good at sales. So if we increase the same practice from that average 45% up to 70%, we see that now they're generating $70,000 in monthly revenue. So that's annually, that's $300,000 of annually increased revenue with the same number of patients coming in, theoretically the same marketing budget, the same overhead. That's $300,000 in additional gross revenue without additional overhead. So what's the difference, right? Because obviously that would be a meaningful improvement in any practice of this size. So how do we get from that average state to that more optimized state? How do we get from A to B? That's the gap. There are some examples of common ways that people are trying to close the gap, but that actually end up causing you to work harder and earn less and decrease the value and the impact of the work that you're doing. So a lot of these decreasing prices to compete on price, like that's a common theme, trying to compete on price, unbundling to compete on price reactively. I'm not saying that unbundling is bad, but I'm saying that if you're doing it to compete on price, it needs to be inspected. Joining third parties, if that's something that's relevant, or any insurance program that's going to cause you to decrease the level of service you're able to profitably deliver without thoroughly assessing it. Price matching, decreasing your marketing spend or any other efforts to lower your overhead, or increasing your marketing to try to compensate for poor treatment acceptance rates. These are all things that people are doing in their practices to try to close that gap. But if we think about your practice and your patients from a high level, they have some problem and they're looking for a solution, right? And the reality is, when people have a hearing related problem, they have options. They could have purchased something online. They could have gone to Costco. They could have gone to their local ENT audiology department. But if they're sitting in that consultation room with you, one thing is true, right? They didn't do those other things yet. So some part of them believes that you might be the best solution to their problem. Now, there's a big issue with hearing professionals. We are generally helpers, and a lot of hearing professionals are allergic to the 4-letter word that starts with S, sell, right? So before we can expect to consistently help patients, we have to reframe our beliefs around what it means to sell, because selling done well is just serving. And when a patient comes to us, we have 3 responsibilities. That's it, just 3. Our first responsibility is to identify their deepest needs, desires, fears, and concerns around the problem that they've come to us for. That's curiosity. We need to actually understand why they're there. What are their concerns? Next, we need to help them express and take ownership of their pain points and their ideal outcomes. So get them out of the state of it's everybody else's problem into the state of I acknowledge that this is my issue that I need to deal with. And then finally, once we've done those first 2 things, and only after we've done those first 2 things, it's our job to guide them to a solution that fits their needs. That's all that selling in this context is. So it's supportive, it's curious, it's patient-centered. It's not salesy, it's not persuasive, it's not unprofessional, it's not pushy. Make sense? All right, so we're going to talk about these 4 common well-meaning mistakes that drive away ideal patients that we frequently do with the best of intentions that end up backfiring on us. All right, so these are the 4, and we're going to go through them in more detail. Persuasive communication, prescriptive recommendations, price-oriented mindset, and product-based solutions. Let's start with persuasive communication. You might find yourself thinking, I don't try to persuade people. I'm not salesy. I'm not pushy, right? But here's the problem. Again, Hearing care professionals tend to be nurturers and helpers. So we don't want to see people going down the wrong path. And there's this concept in motivational interviewing, which is a counseling framework it was originally developed for addiction counselors, people who their job is to take somebody from a place of ambivalence, like I know I need to change, but into a place of self-ownership. I'm actually going to create the change. So this concept out of motivational interviewing called the writing reflex, the definition of that is when we try to fix what's wrong with people and set them on a better course by directing them. We try to fix what's wrong with people and set them on a better course by directing them. This is almost always done with good intentions, but it backfires, okay? So I'm gonna show you guys some examples of what this looks like. All right, so patient says, I've heard you can get premium hearing aids at Costco for $2,000. I'm the clinician. I say, yeah, you can, but their premium hearing aids aren't the same as ours. They have features removed. Plus, you never know if you're going to see a quality provider at Costco. I know I have a hearing problem, but I don't really want to wear hearing aids. And I say, sure, I understand that, but did you know that untreated hearing loss is correlated with an increased risk of dementia? Plus, the longer you leave your hearing untreated, the worse it'll get. The issue with the writing reflex is it puts walls up. Makes people feel uncomfortable, ashamed, argumentative, they become defensive, and they shut down. I have this philosophy around patient counseling that our goal should be to be their trusted guide, meaning that instead of like the patient is on this side of the desk and they don't really know that much and they're just here to seek my advice, and I'm on this side of the desk and I'm the expert and I'm the professional and I'm going to tell them what to do and correct them. It's collaborative. We're on the same team, and my job is to understand where they're coming from, to talk to them with empathy, and to help guide them to whatever they're trying to achieve in working with me. Okay, so give you guys some alternatives here. The core concept here is curiosity. We need to learn to drop our attachment to our desired outcome, which generally our desired outcome is that they're moving forward with treatment, right? If somebody's coming in for a hearing evaluation, that's what we want to have happen, but we have to drop that. And we just have to get curious about the person in front of us. Like, what are their biases and viewpoints and concerns, and what's their ideal outcome for the appointment? And instead of responding to these statements like this is an error that you need to correct, we just need to get curious. So here's what that might look like. So Costco question. I've heard you can get premium hearing aids at Costco for $2,000. What you could say is, you're right, Costco does sell cheap hearing aids. What caused you to come see us instead? Curiosity, because they're here, they're not at Costco, right? Why did you come to us? I know I have a hearing problem, but I really don't want to wear hearing aids. So it sounds like you know that hearing is a problem that's impacting your life. Tell me more about your concerns with hearing aids. Curiosity. You're going to get more information. You're going to maintain alignment. Here are some frameworks for curiosity-based responses that you can use in the clinic. Open-ended questions are really good. And it's important to be clear that you're asking open-ended questions. Like, how is that for you? You know, tell me more about that. Versus closed questions, like, is that difficult for you? That's a yes or no question that's making an assumption, right? Clarifying questions is just, in a lot of cases, what we are perceiving the patient is saying and what the patient is actually trying to communicate aren't actually always in sync. So this is just clarifying. It sounds like, is that right? It sounds like, here's what I heard you say, is that right? And then reflecting. So on one hand, you know your hearing is a problem, but on the other, you feel that hearing aids are too expensive and rarely work. And then zip it and let them think and reflect and respond. Would that be different? Can I get a yes or a comment if that would be different than how you've been handling things? Is that new information or a different way to think about things? All right, number 2. Prescriptive recommendations. Good, cool. So here's what a lot of us are taught. Can you say yes if this is what you're doing right now in the chat? This is what a lot of us are taught when we talk about solutions. One strong recommendation. Based on everything we've discussed, so this is what it would sound like. Based on everything we've discussed today, for you to hear your best, I recommend the premium solution, which is an investment of $7,000. Yep. So I know I personally was taught to present solutions this way by manufacturer trainers and buying group trainers. And on the surface, it kind of makes sense, right? Like, after all, I am the expert, right? The patient came to me, looking for a solution to their problem. And if I don't make a confident recommendation, then maybe they'll just go somewhere else. But if we think about it from the patient's perspective, we've spent this entire consultation trying to build rapport and trust. And then when we recommended a solution, it's a premium top of the line solution with no discussion and no alternative and no patient input. So has the potential to undermine trust. And this is the reality of the current world. Like, this is different. The world is different than it was 10 years ago or 15 years ago or 20 years ago. In the past, as professionals, we had a lot more information than the patients that were coming in. They just didn't have access to the same information that we did. So they really didn't have any way to cross-reference what we recommended for them other than just going for a second opinion somewhere else. There is information asymmetry, which is seller-centric. I can just kind of get away with saying, here's what you need, take it or leave it, right? Today, the world's very different. Anybody can hop on the internet and watch a dozen Dr. Cliff videos and go on hearing tracker forums and have conversations with other patients and read reviews about products and know exactly what's going to happen in their evaluation. The patients have access to the same kind of information that we do. And the psychology of younger patients is that they want to be involved in decisions. Now, this isn't black or white, right? You might have a patient who is a sweet little 93-year-old woman who comes in and she just wants, you're the doctor, and she just wants you to tell them what to do. That's different because she's giving you permission. She's saying, just tell me what I need to do and I'll do it. When somebody gives you permission, that's different than you just telling them this is what you need to do. So my approach that I've landed on as more optimal based on testing is presenting a limited range of solutions, describing the differences transparently, and then using strategy, evidence-based communication strategy to have that conversation. So we're guiding, we're not prescribing. And so that might look like, I'm going to show you a few of our most popular treatment plans. These plans will include all the services and benefits we've just discussed, which, sidebar, hopefully you've talked about what's included in your treatment program before you're jumping to prices and products. I'm going to show you the plans. We'll discuss the differences so we can find the best solution for you. Sound okay? And then we jump in and talk about solutions. It's a simple change, but it's not as easy, right? It does require more strategy in the words we use and the order we present things and the pricing and the program structure. It takes more nuance to clearly differentiate to the patient how the different levels of solution are going to impact their day-to-day life in a meaningful way. In my practice, we use the one best solution approach for close to a year, and our trainers were really dissuading us from changing to a range of solutions. But I'm a business nerd and I like testing things. And so when we switch, and our consultation was very structured. So the only variable that we switched was going from one solution to a limited range of solutions. And we saw in our clinic that our treatment acceptance rate went up by close to 10%. And we continued to have about 70% of our patients move forward with our optimal or our premium solution. And that single change led to like 6 figures of growth in our practice. But again, you have to do it effectively, and with your communication has to be on point. Otherwise, you do risk this kind of backfiring and having this thing where everybody goes to the middle of the road solution, and it's not even necessarily in the patient's best interest. So it does take more nuance. And then this is I find when I work with audiologists and hearing professionals around patient counseling, I find that clinical silence is a real challenge. The ability to say something or ask a question and then zip it is really hard. We tend to talk and we tend to educate. So when we're presenting solutions, we present it, we explain it, and then we zip it. And then if it's quiet for a long time and they're just like looking at us like, okay, then you say, what are your thoughts right now? But don't keep talking and talking and talking, because often you can talk your patient out of their thought process that they need to go through. All right, number 3, price-oriented mindset. This one is insidious, and we often don't realize we're doing it. So I'm going to share some symptoms of a price-oriented mindset. So these might be things, if you're a practice owner and you have a team of providers, you might, maybe it's not you, but you might recognize these behaviors in some of the members of your team as well. So if you find yourself saying we need to compete on price, we need to be competitive, that's a sign. If you find yourself discounting a lot, reducing prices, primarily fitting lower entry-level devices, price matching, joining third parties that don't allow you to deliver high-level care profitably, and self-doubt around pricing. These are all pretty classic symptoms of price-based selling. Are any of those landing for you? I would be surprised if more than half the people here don't at least have one or two of those that feel pretty on point with how your psychology is. Most audiologists that I talk to, this is a challenge. And yeah. And if you find yourself feeling kind of defensive about this, like, I understand when I have this conversation with people, this ultimately what we're digging into here is your money mindset. And money mindset it's deeply ingrained and it's deeply personal. And for a lot of us, it comes from like impactful and sometimes painful experiences that we've had in our life. Yeah. And sometimes it's interesting because the reason it's so insidious is because sometimes we put this money mindset stuff, we put it in a nicer wrapper. We say, I want to make sure my patients can afford my care. Or we say, I don't want to price out people that need my help. Anybody? And that's challenging. The reason it's so insidious is because it comes from a place of truth, right? You are compassionate. You do care about your patients. You do want to help. But the challenge here is that hearing care is your livelihood. It's a business. And ultimately, you're providing life-changing value to the people that you're serving. So just to dig in a little bit more on some of the why behind why some of this happens and how it ends up impacting us. So here are three common money mindsets. Scarcity is the belief that there's a limited amount of money or resources available. What this leads to is that you undercharge for your services out of fear that if you charge too much, you'll drive away potential customers or patients. And the problem is when you undercharge, you devalue your time and expertise, which for you can lead to resentment and burnout. And it also tends to attract the types of patients that you don't want. It attracts bargain hunters, right? People that don't value your care rather than people who are willing to pay a premium for your expertise. Abundance mindset is kind of the opposite of that. You believe that there's plenty. You believe that there's a lot of opportunity and money out there, and you should price your products and services accordingly. And this tends to be self-fulfilling because when you're confident in this, it positions your practice as a leader in the market. It's a self-fulfilling mindset because you tend to attract higher level patients who are happier to work with you, who are less of a pain, and who are happy to spend money to work with you. And then finally, this one's tough, but worthiness. If you have a low sense of self-worth, you might tend to underprice your offerings out of a belief that you're not worthy of charging high prices. I teach practice management at my local AUD program and always like to start that program by talking to the graduate students about money and income. And a lot of these students are coming into the field already with a belief that they don't really deserve to make a high income. It feels uncomfortable to even talk about earning a high income. But the problem is, again, it's self-fulfilling. And when you underprice, you attract low quality patients, which devalues your time and expertise. But if you raise your prices to a level that's concurrent with the level of value you're creating, it sends a message to yourself and to your patients about what you're worth. And it leads to increased self-worth, and it is a more sustainable business model. So hopefully that's a little bit of an aside from clinical stuff, but hopefully helpful to reflect on. So we need to drop the focus on price and examine the money mindset if these are issues, right? Your concern about price comes through the patient and it undermines your trust. I want to share, I had a student in one of my patient first program who she came in, and this was her big issue. She was really hesitant to charge for her services, and she was afraid that people would go to her cheaper competition, and she just didn't really feel like she merited charging what she was worth. So I just want to share this.
I'm super busy. I had a test last week and I didn't sell a hearing aid and I was shocked when they walked out. Probably when I started talking to you, probably doing 10 to 12 units a month, and I think I have 30 this month. Yeah. I think, you know what, you said something to me that changed my whole attitude, and it was right at the beginning. And it was like, if they're not going to come to you, they're going somewhere else. And if you have a problem around pricing, it's showing. And, like they already know. I think just kind of following the steps, just laying it out, and this is what it is. And they're like, yeah, let's do it. And they're not even balking at the price.
So pretty cool. Confidence makes a big difference. Any takeaways there? Shift to a focus on value. What are your patients' concerns and ideal outcomes? Release your attachment to your ideal outcome and act as your patient's trusted guide. It's incredible how your mindset about yourself comes through to your patients. And if you are coming from a place of service, like I'm here to help you get what you need, then it's a lot easier to be confident in having these conversations. All right. Last one, product-based solutions. All right. Are hearing aids the solution to hearing loss? So this is the first question we have to ask ourselves. Like, do we actually believe that hearing aids are the solution to hearing loss? Do you? If you follow me, if you follow my stuff online, you probably know that I talk about this a lot. If you believe that hearing aids are the solution, then you're going to transmit that belief to your patients, and you've just commoditized yourself. Because if hearing aids are the solution to hearing loss, then the next logical question becomes, where's the cheapest place I can get good quality hearing aids, right? So that's number one. And then to go a level deeper, is hearing loss actually the problem that you're solving? Or is it the impacts of hearing loss on your patient's life? When we can dig deep and get clear with our patient about the true problem and the pain that it's causing, we shift from selling hearing aids to changing lives, and you can charge a lot more to change lives than you can to sell hearing aids. It's an important distinction. I posted this on LinkedIn recently, and I feel like it really encapsulates the concept. Your patients don't care about hearing aid features. They care about staying connected at home and work, avoiding embarrassment, not losing status amongst their peers, appeasing their loved ones who are frustrated with their hearing as normally as possible with the least effort possible. Tell them how your program gets them the things they care about. So I'll say this until I'm blue in the face. If you're focused on treating hearing loss with hearing aids, you're a commodity. You care about hearing loss. You care about hearing aids. That's your training, right? Your patient cares about Jan in accounting who's cracking jokes about how they can't hear in meetings. So you need to talk about Jan in accounting and not hearing aids. This is an important distinction. Somebody made a comment earlier. It was something about like differentiating so that price isn't the service, right? If a patient can't tell the difference between you and your competitors, it's only logical that they would compare you on price. Say it again. If a patient can't tell the difference between you and your competitors, it's only logical that they would compare you on price. Your responsibility then becomes, number one, building a program that's actually valuable and effective and evidence-based and follows best practices. You actually have to be different. That's number one. You can't just sell them a load of BS. But then number two, once you have that, packaging it in a way that's clear, that's simple to understand, and that's high value to the patient, ideally branding it, and then communicating how your program is the solution and hearing aids are just part of your program, right? And the reality is, like, it's not that you'll never have a money conversation again. The reality is that we're having a conversation about something that for a lot of people is a meaningful amount of money. But what happens is you go from having deal breaker price objections, like, thanks so much for all the information, I need to go do some research, right? Or it's been really nice and I've learned a lot, I think I'm going to go see about those Costco hearing aids. So we go from that to them asking for our advice, and money is a logistical issue. We're talking about payment plans, or we're talking about maybe unbundling some of the services away up front, or maybe going to a lower level of technology so they can afford it. It's logistics versus deal breakers. That's a big distinction. The reality is that we'll probably also have to talk about hearing aids as part of the solution, right? Hopefully we're demonstrating technology and we're talking about what it does. So when we talk about technology, we need to focus on the WIIFM, which is the what's in it for me. The patients don't care. Most patients, important distinction, most patients don't care about the technology. You do get like engineer brains, and then you have to walk that tightrope of like not getting too deep in the weeds. But for most patients, they don't care about the technology. They care about what's in it for me. And so, for example, if I'm talking about hearing aid brands, a lot of providers might say, these hearing aids are made by Phonak. They're one of the best hearing aid manufacturers out there. They do X, Y, and Z, and it's really incredible. What you need to do is contextualize it to the patient. So, for example, Mr. Johnson, I know you travel a lot for work. And one problem that a lot of people don't realize is a lot of these big companies that you see advertising hearing aids actually sell what are called locked hearing aids. And what that means is that you have to go back to them at one of their stores to have them worked on. With us, we never sell locked hearing aids, for one thing, and we work with some of the most popular brands because next time you're traveling, going to a work meeting, if one of your hearing aids stops working, you can go almost anywhere in the world and find a provider who will be able to work on that for you, so you won't get stuck without your hearing on your trip. See the difference? Like, contextualize it to the person as opposed to just talking about the feature, right? And you can do that with basically anything that we're talking about with hearing aids. It's not that you don't talk about them, but you just put it in the context that's relevant to them. This is a concept that I teach in my program. It's called Market of One treatment programs. The idea being that you aren't competing with other people in your market. You're different than people in your market. This is a framework that lets you create solutions where, number one, you're proactively addressing patient concerns. What I mean by that is there are universal concerns that patients have around like aesthetics and future cost and comfort and friends that wore them that didn't like them. We want to make sure that our program proactively addresses those concerns. We want to reveal unknown problems with commodity programs in our solution. Like I was just talking about with the locked versus unlocked hearing aids, most patients wouldn't even know that was an issue. But because I said in our program, we never do this because here's the value to you, I'm revealing something that's different from us and our competitors and revealing that value of our program. Build trust and likelihood of success. One of the really big reasons that people don't move forward with treatment is because they're not confident that it will actually get the results. And so, however, like anything you can do to lower the doubt and decrease the perceived risk within your treatment program, the higher likelihood they're going to work with you. And then the goal of this is to create such a robust program that you do what's called value stacking in the marketing world, where you create so much perceived value that it feels like your service is worth significantly more than the asking price. And then bonus points if you brand it. So I don't know if you feel like you're drinking out of a fire hose here or not, but assuming that you're now buying the concept that having a system around your consultation process is important if you want to help more patients, I want you to leave with something tangible. So in just a minute, I'm going to share that tool that I was telling you about that's going to basically give you a rating on how your current consultation process is working. The concepts that we've talked about today are like the foundation of how to do this stuff effectively and get patients to say yes to treatment. One thing, as I was building these programs, I identified that there are kind of like 4 pillars that if you can effectively execute all 4 pillars inside of your consultation process, you're going to have success. So these are the 4 pillars. So if you do these 4 things well, you're going to be successful. Number 1, having an appointment choreography, a choreographed consultation that's designed around creating peak experiences. What I mean by choreographed is like we have a system. It's choreographed and it's structured to bring a patient through a predictable process every time. You don't say exactly the same things, but it's a structure, okay? And it's designed to create a result. And when it's systematized, you can talk about it in your marketing. You can talk about it in your pre-consultation warm-up information that you're sending out to your patient. Number 2, Market of One treatment programs we just talked about. Number 3, trusted guide communication framework. This is everything from like the writing reflex stuff to how we present treatment programs, to how we handle objections, to how we ask questions during discovery to try to preempt objections and stop them from happening in the first place and address the concerns. So it's best practice, evidence-based communication strategies. And then number 4 is actually having practice, coaching, and accountability. So if you're a solo provider, this is harder. If you have a team, then this is like actually putting on the schedule role play, reviewing KPIs, tracking KPIs if you're not already, like measuring relative to budget performance, like how coaching our teams and ourselves as clinicians, like actually working on this stuff and having a system of accountability. So if you have all 4 of those concepts happening inside of your practice, you're going to be like in the top tier performing audiology practices. This isn't stuff that I just made up. This is based on existing business principles and concepts from other healthcare fields that have been actually like studied and researched, and communication and decision-making psychology. This is what I used inside of my practice that got us from 50 to 70%. So anyway, it's been really cool to see as we put these systems into practices that it just increases. You can see the confidence go up. You can see the revenue go up. They're helping more patients. Sorry, I didn't change the screen there. So I was just talking and you guys didn't see what I was talking about. So here's what I'm going to give you is I've been working on this for a while now. I'm going to give you guys, I should be able to pop a link up on the screen here so you can grab this. All right. So I've been working on this a while, and basically what this is going to do is it's going to score your practice relative to those 4 pillars that I just showed you. It's called the patient first consultation audit. The way it works is you answer 20 questions about your current process. It takes like 10 minutes. And then you'll get an overall score, and then you'll get pillar scores for each of those 4 pillars. And you'll get custom feedback based on your score, giving you like, here's the next steps of what you need to do in your practice. This is going to be something that is just in my paid programs. Eventually, you guys are the first ones that I'm showing it to. I am actually limited. I can only do 200 reports per month. And I do have like 250 people signed up for this event. So if you want to use it, go ahead and click the link. Now, I'm not pitching my program here, but if you do want to learn more about working with me in your practice to try to like actually get some structure and coaching and training and accountability around this stuff, this consultation audit is going to be the first step. So go ahead and do that. And you'll be invited at the end to have a strategy session where we go over your audit results and talk to you more specifically about how to apply this inside of your practice, or if you have a team, how to start to get this stuff activated with your team. And just one kind of like full disclosure, I'm much like you guys have the types of patients you want to work with. I have the types of providers and practices I want to work with. So I'm only interested in working with practices that are committed to actually providing evidence-based high quality care to their patients, and they're actually open to being coachable and learning and improving these systems in their practice. So, but either way, I would encourage you guys to grab one of those because I worked really hard on it and I think it will give you some really meaningful information. All right, Q&A. Yeah, you can sign up as a staff audiologist. Let me see. I marked a couple of these as questions. If I don't get your question here, I'm going to go ahead and answer them. Lals, are you still here? I wanted to ask for clarification what this means. I have an issue with putting my words across in a gift wrapped way. What do you mean by that? Yeah. So you have a hard time. So Lals's question, just basically saying things in a way that comes across as polished and professional. It takes practice, right? Like this is different than the clinical training that you did. This is its own system. When I was a new grad audiologist, I literally, driving to work every day, I had a CD of objections, and I would put the CD in my car and I would listen to these objections and I would hit pause on the CD and I would reply back. And I would do it over and over again until I could get fluent with my responses, because it's not something that you just automatically are able to do. It takes practice. And if you don't have that type of like system inside of your practice, that's where I've spent a lot of money hiring coaches over the years, because you're going to shortcut the learning curve and get better at it a lot faster if you have somebody that knows what they're doing help you. Do you have any advice on what to do if a patient has left and what actions to take for follow-up? I do. Yep. I do. I actually have a lot of thoughts on that. I would say it's a little bit outside the scope of what we're doing here, but do the consultation audit. And there's actually some specific feedback on that, because that like pre and post consult process is a really important process to get buttoned up. One thing I will say is it's a fine line of professionalism. I think that when you are doing tested not treated phone calls as a professional, you just have to really be mindful that you're not a sales rep, that you're generally coming across with curiosity and from a place of service. I think from a high level, that's the biggest thing, is like, make sure that you are staying in touch, make sure that they don't just feel like you never thought about them again, but don't be pushy, don't be salesy. Fair? Thanks, Tony. What other questions do we have? I'm going to answer Lossa's question. Yeah, role play is a big thing. When I was lucky, because my first job, the practice that I was in, that was part of the cultures. We would just, between patients, we would be looking at the schedule, and between patients, if I knew, for example, a patient had been out in demo devices and they were coming back in, and I knew kind of what their concerns were going to be, I would be the provider, and my other audiologists on my team would be the patient, and we would just practice and give feedback and just do it a few times until it was fluent. And it just makes you so much more comfortable when you get into that consultation room having those conversations. Melissa says, let's see. People start out by listing all their complaints of hearing problems, then I do the hearing test review results and recommendations, and all of a sudden they act as if their complaints that they shared at the beginning are not that big of a deal. So there was always a wall that I didn't know how to respond to get past. When something like that happens, it normally means either you missed something or you move too fast. Probably that you're moving too fast. I think the biggest mistake that we tend to make is we jump to the next thing before we've gotten an agreement from the patient that it's okay to jump to the next thing. So like one power question that I teach is, when we're in discovery, before we've done testing, we're doing like needs assessment and case history and all that stuff, and we're about to transition into testing, just telling the patient or asking the patient, if we identify a hearing loss that needs to be treated, are you open to a conversation about treatment? And then you just get they're okay. And then if they give you pushback, that's good, because now you can address the pushback before the walls have gone up, right? But typically it's because you kind of blasted through their emotional readiness to move to that next part of the conversation. Yep. Yeah, that's really common, because again, and where that comes from is that place of like, I have my goals, which is a treatment conversation, and I'm focused on my goals, and I've kind of lost focus on the patient and where they're at. All right. How would you deal with patients that got a great deal from us before because the provider gave a great deal, or because we raised prices since? They expect a deal again. Our team wants to honor their loyalty. Well, you have to be able to communicate value, and it is a challenge if you haven't changed anything and you've significantly raised prices. But I think people also realize that, prices go up over time. But ultimately it's all about value. It's all about communicating value. But yeah, I mean, if you change prices or you change policies, you're going to lose some people. It's just about communicating in a way that doesn't frame it. Here's the mistake, is if you frame it from your perspective. We want to make sure we're being reimbursed properly. In the past, we didn't charge enough to be able to provide the level of service. Wrong. We're now doing X, Y, Z that's providing a lot more value to our patients. And part of that increased level of service now comes with this change in pricing. Frame it around the value that they get, not making sure you're taken care of. That's like super turn off for people if you frame it from your context. Hopefully that's helpful. Yeah. So Damien asked about how you like schedule that. So a big part of it is just, if it's part of the culture, then it just kind of happens naturally at lulls during the day. So it's not even always that it's on the schedule. But when I was an owner, what I would do is I would block time on mine and my provider schedules And as an owner, hopefully you have work on the business time as opposed to work in the business time. So your part of your work on the business time is coaching your team, and you're investing your time and you're investing their time to help coach them to be a better provider. So it's all about blocking it on the schedule and actually following through with it. And then also creating a culture of practice and training and role play so that you are doing it consistently without it being on the schedule, just because the providers all see the value because of how much more effective they are when they get in the room with the patient. Yeah. So Daniel, the practice you're purchasing has been selling devices at low cost. I mean, yeah. So that's an interesting challenge, right? Like if you're buying a new practice, or you're coming into a new location or a market that low cost has been the expectation. Markets are different, so you have to communicate value differently to different markets, but it all comes down to them, not me. So maybe you still have low cost solutions available, but you always lead with the biggest value. And then you take things away from the high value solution to get down to the low cost solution. So essentially, if you start high and then you're like, we still have those solutions, but here's what we're recommending for most of our patients now. And then you still can offer the lower cost solutions. What you'll find is a lot of people will naturally kind of shift up into the higher value solution. All right. Advice on what to do if a patient has left and what actions to take for follow-up. I kind of answered that earlier, but really, again, the concept is curiosity, empathy, and service. Without being too tactical, that's the mindset: curiosity, empathy, and service. So what would you recommend number of solutions to offer? So, I mean, it's the paradox of choice. When we have too many, like when we have the cereal aisle with like 200 different kinds of cereal, we just don't do anything, right? But if we have to choose between three, it's easier to make a decision. I think three is the sweet spot. People's brains work pretty well in threes, but that's just what you present up front. It doesn't mean you don't have other solutions, but you start there. And then you have off list things that you can go to. Is that helpful? Cool. Let's see what Tracy said. How detailed are the solutions? What do they entail other than hearing aid tech level? Yeah, I mean, that does kind of get in the weeds a little bit, which is why this is a more nuanced way of approaching things. High level, though, is you need enough differentiation to be able to clearly talk about the differences, but you don't want so many differences that the decision becomes overwhelming. So that's the balance. You need to be able to clearly distinguish them, but you don't want to make it so many like concurrent decisions that they get overwhelmed and don't choose to do anything. So, to get practical about differentiating between technology levels, I think that the most important thing is, I think this is one person's opinion, but I think sticking to like 3 manufacturers, you can almost always find 3 manufacturers that will cover almost all of your patient needs. So if you have 3 manufacturers and you're talking about 3 tiers of technology, and you know in your clinical brain what is in those 3 tiers, what you can do, and this is where you need to do the work ahead of time. But what you can do is you can clearly distinguish and relate back to what's happening with them, those 3 tiers. So like, for example, like with Oticon products, maybe your top 2 tiers are the reels, and then your third tier is, what is it called? The zircon now. And you do like the 1, the 3, and the more entry product, so that there actually are clinically meaningful differences in performance between them. And then you just talk about, like, with this product, hopefully you demoed and you say, and so during the demo, you've been talking about why this is what you recommend. And then you can say, this is what I recommended. And remember, it does this surround sound where it analyzes what's happening so that you can, if it's really noisy, you can still look around and follow the conversation. When we go down here, what you lose is now it goes from separating the speech a lot to not quite as much separation. So it's still scanning the room and you're still able to hear people all around you, but there's not as much separation between the speech and the noise. And remember when we tested you in the booth, talking about the Quicksand, remember when we tested you in the booth and the words got closer and closer to the noise and you started to have a lot more trouble when the words were closer to the noise? That's more what that's going to be like in the real world. You're just going to have to focus harder. It's going to be more effort and you're more likely to miss things. And then when we go down to the next level, we're not doing the surround sound thing anymore. Now we're using what's called directional microphones, which basically just means your hearing aids are focusing in front of you and dimming down what's around you and behind you. So in that noisy dining room, you're going to be hearing what you're looking at, and it's going to dim down the other stuff more. So you really take it down to very fundamental differences, but with integrity, with honesty, and then apply it to their situation. Is that helpful? Thank you all for sticking around, and look forward to seeing what you get on the consultation audit, and hopefully we'll be in touch soon. Take care.